have you on. All right, yeah, please. All right. Good morning, everybody. I wanted to, first of all, thank you for being here. I also thank Governor Parson for his leadership with us, and he'll be talking to you in just a moment. I'm also joined by Dr. Randall Williams, who has been outstanding in advocating for the public health interests of the people of Missouri. A few things I'll note, then I'll get out of the way for the governor. One, we have had productive conversations, frankly, with his staff almost daily since this crisis began. Last evening, the governor, myself, a number of mayors from Missouri's largest cities talked about a decent number of issues. Most prominent among them is likely the 50-person limit that we are instituting for large events. That's a reduction, at least in Kansas City, from 1,000 persons down to 50. They've also talked to us about a number of issues relating to testing, resources for our public health, public safety responders, and so many others. A few things I want to note. Situations are changing fast each day, and that's why it's important that we've had cooperation not just among Missouri cities, not just among different states, our federal government, but we will continue to have conversations as time goes on. There are some people who ask me questions sometimes that include this question of, well, you just said 2 days ago this, why has it changed? Well, frankly, we're listening to the science, we're listening to our medical professionals. I know the governor and I are both not scientists, that's why we trust people like Dr. Williams and Dr. Rex Archer here in Kansas City. I will note one other fact for you this morning. We were able to have a conversation that the governor was center for, and we appreciate it. The police chief was present, our fire chief, Donna Mays, our director of neighborhoods and housing services, John Wood, because there's lots of questions relating to our homeless population and so many others, and our director of EMS services, Dr. Erica Carney, talking about our public safety response. We continue to be in contact with our schools and businesses. I will have more for that after, but the governor's on a tight schedule, so we will have him speak and Dr. Williams answer any questions for you. Governor.
All right. Mayor, thank you very much. It's always good to be in Kansas City. We're going to be traveling around the state the next couple of days to a lot of the cities to really take and make sure we're doing everything from the state level to be able to communicate with the mayors and the communities around the state. That's very important to me, especially with this situation that none of us has ever been through this before with the coronavirus, and communications is critical to make sure that we're on the same page of decisions we're making as much as we can be, and then that we're really out there providing the services we need for the people of the state of Missouri. And I think that's important for me to be out as governor of the state, to be working with it. I can't express enough how much the mayors, the county commissioners across the state, emergency personnel have been to the table that we're trying to communicate with. Every week, shortly after this press conference, I'll be talking to the Vice President to an update he's doing for the governors every week, that we're on a phone call with him. That's a lengthy conversation normally about what's going on the federal level. The other thing, we are now having a phone call to Missouri county commissioners, emergency personnel, mayors. That's somewhere over 1,000 each Tuesday when we're on those, and again with our separate meetings to have. The number one issue that we know are on people's minds is the testing process of that we think there'll be some significant changes to that in probably the next couple of weeks. I think we will be in the category where we can do thousands upon thousands of tests a day, that we're going to be able to do that. I think it's important to know that every day is a challenge, to a certain degree, of what happens differently. And we have to adapt to that every day. That's why the communication line was so important, why the meeting's there. And really to make it understand, it's just not the person that maybe has the virus, but it's the people that's going to be affected by that. Emergency personnel, EMTs, police officers, and all the people that could be affected by that. Again, I think those are priorities of ours in the state right now. Those are the two issues we hear the most of. We're also on the PPE equipment, to making sure we get that out. We'll be able to do that. That was part of the executive order I signed, is to speed that process up. If we need to waive some regulations, we need to be able to do something differently on the law, we will, to be able to make sure we get that to the local levels as soon as we can. With the emergency declaration I did last week, that frees up a little over $7 million that we'll have access to in the state, along with the $13 million that we know will be coming from the federal levels to be able to utilize that to help with the local levels and make sure that gets distributed around the state. I think it's also important that at the end of the day, people are going to have to take some responsibility on their own. Government's not going to be able to fix all this. We're going to be there to do everything we can possibly to help the people of this state, but at some point there's going to have to be some common sense used here, and there's going to have to be some personal responsibility of how we deal with this issue. So the good news for the time being is I think help's on the way. I think you're going to be able to see a lot more in the testing side of it that's going to be a little reassuring for the people of this state. I think you'll also see mobile testing sites that will be coming up from different areas around the state, so the people that maybe has a little more trouble having access to health care, that we're going to provide that, be able to have that screening for them wherever they might preside. So I think that's something important with that. So with that, I think I'll just open it up for a few questions. Dr. Williams is here to answer any questions that you might have any of the testing portions of it or thing. I'll give you a little update on the state level. As of today, when I left Jeff City, there was we've done 170 tests in the state at this point. There has been 6 positive. There was 1 that come in early this morning in southwest Missouri. We are still in the process of those notifications and getting that, but the 6th out of that 176 have tested positive at this point that will do that. Or presumptive positive. I guess I'll be careful. I'll let Dr. Williams clarify that. We still have some presumptive positive going through CDC, but now we have the authority to call them positive ourselves in state. But I think the bottom line, most of it's going to be positive. The 6 will be positive on that. So with that, you want to open up questions, Kelly?
Sure. Governor, what? Go ahead,
Mike. Governor, are you going to recommend or order a limit of 50 persons in restaurants and bars throughout the state?
At this point, we are taking the recommendations of the CDC. The CDC has exempted schools, higher learning facilities, and businesses. I think at this point, what we did yesterday is we are recommending that no more than 50 people be together at a facility. Again, it's going to take some of the private sector is going to have to step up and say, are they going to follow that or are they not? But at this point, it's not a mandate, it is a recommendation.
Can you restate the situation on the number of available tests and what's coming?
I'm sorry, on the question?
Governor, can you restate the availability of tests in the state right now and what is on the way?
Yeah, I'm going to let Dr. Williams address that because I think there's different ways that's going to be done. But let me let Dr. Williams just answer that right now.
Thank you, Governor, and thank you, Mayor. You know, Dr. Archer and I are both scientists, and I would just say that Kansas City Health Department, I'm very involved nationally, is one of the 5 best in the country. So as we develop our response statewide, we're certainly appreciative of the mayor's team here. To answer your question directly, you're going to see a fundamental shift in our response here from travel acquired to people in Missouri. And to do that, as Tony Fauci said yesterday, so oftentimes of challenge in the United States, whether it was World War II, our industrial might comes to our aid. So the American Clinical Lab Associates says by April 1st, we will be doing 280,000 tests a week through our commercial labs, LabCorp and Quest and others. So if you break down Missouri's population of 2% of the country, that's almost 6,000 tests a week. If you add that to WashU going online on Tuesday, which we hope they'll get up to speed very quickly to possibly 1,000 tests. You have Lee Summit doing 1,000 tests today. And the University of Missouri coming up, that we hope by April 1st to shift our capability to have the test to test all Missourians who have a fever over 100.4 and a cough. And we will move that out to local mobile testing sites. If you think about it, once we get through flu season, there isn't a really good reason to have a cough and a fever unless it's pneumonia. And so we want, our strategy is really based on 3 things going forward. And that is that if you have a cough and a fever, we want you to call a provider and let us know. And we want you to self-isolate. And we will get you tested, and we think that's going to be critical to keeping us ahead of COVID-19 while we are now in Missouri.
The CDC has already updated its testing guidelines. Are you concerned that if we're only updating by April 1st that we will be undercounting for the next 2 weeks?
Well, again, we have to save our test in the next 2 weeks for those who are most critically ill. For the state lab, we have the most stringent criteria. As you know, for commercial labs, they don't have criteria. That's between the provider and the patient. But I have to remind you that for the most stringent criteria in Missouri, and these are people who the provider would tell you, I'm almost positive this patient has COVID-19, only 6 out of 170 have been positive. So until we get on board for the next 10 days or so, we'll still follow our criteria. But our goal is by April 1st to shift those criteria to make it more statewide than travel-related.
Governor, what conversations, if any, have you all had with the White House regarding possible curfew?
I didn't hear the last part. I heard you say
What conversations have you all had with the White House regarding a possible curfew?
I've not had any conversation with the White House about curfews at this point.
Okay.
We'll be talking to the Vice President later today. You know, really the main thing I think when we're talking, the conversation between me and the Vice President have basically been one on the testing, what are they doing on the national level, get the product out, and what are they going to be doing on the state levels to help us financially, and what are we going to be able to do. I think it's important to realize this changes daily. So anything I could be sitting here telling you today, after I have this phone call today, could change,
yeah.
and it's important to me.
Can you discuss a little bit how, like for you, how have you grappled with, I'm sure you've heard from business owners, from community members, from church leaders about weighing, the public moving on and keeping business going and things like that versus, having to do public safety. Tell me how you've grappled with those things yourself as the governor.
Those are tough decisions. I'm a former business owner, and I know that's going to have an effect on the economy when you start talking about these things. I think it's important, but at the same time, you're going to need grocery stores are going to need to be open, pharmacies are going to need to be open, essentials are going to need to be there. But yeah, it's a tough decision when I think of so many businesses out there, whether it be restaurants, whether it be the entertainment side, whether it be tourism, it's going to have an effect. But again, I think the public safety has to be the top priority here of everything. And, Missouri's went through tough times before, and we're going to go through these. And I truly believe in the near future we are really going to know much more in 2 weeks, in the 10 to 2 weeks that we're talking about. We're going to know much more about that. So right now, again, we're just asking people to try to help as much as they can help from the private sector and, be responsible.
Dr. Williams, how many tests are available right now in Missouri, Dr. Williams? How many tests are available to you and health departments around this state? How many tests right now? I know more are coming, but how many now?
Williams? Sure.
We'll take your question next, and that will be it.
We have the capacity in our state lab to do 1,600 a week now. We have the capacity out of Lee Summit to do 1,000 a day. WashU has the capacity to do 50 a day starting on Tuesday. 50, but that will ramp up very quickly. And all they were waiting for was a positive sample to run their controls on, and we gave that to them, and they immediately got going the next day. So it's very much a cooperation with our partners. And then with LabCorp and Quest, I think LabCorp said that they would be doing 10,000 tests a day by this Friday and 20,000 tests by next Friday. And so they're part of that 280,000 a week. So if you do the math, looking at LabCorp doing 20,000 tests a day throughout the country, I would say probably at this very moment in time, we are at the ability to do at least in order of more than 1,000 a day in Missouri. Looking at if you just look at the lab in Lee Summit, they're doing 1,000 a day. So again, as we transition to testing everybody in Missouri who has a fever and a cough, it'll take us about 2 weeks to get there. But at this very moment in time, we certainly feel like we have enough tests to cover those people who we're most concerned about. But our goal is to move out that to get everybody as early as they might present, identify them, and self-isolate them.
Okay, ma'am.
Have you identified yet whether the case identified this morning and the latest Henry County case are travel related? The labs came off at 3 o'clock this morning. Again, we're incredibly fortunate that Bill Whitmar, who's a president-elect of the American Public Health Lab Associates, he ran his team last night. We did 43 tests.
kind of under unique circumstances, and they came off at 3. And so we notified that county at about 4:30 in the morning, I think. And we're trying to follow our standard operating process, which is that they go out and talk with the patient, and then they get that information back to us. So I don't have that at this moment, but I think we'll have it by noon.
Why hasn't high school state basketball?
Let me finish up. Just making one last comment. Again, I want to thank the mayor and for the people that are here this morning, but for the media that are here too. I think it's really important that we make sure that the public knows as much transparency as we can give them from the governor's office, from the mayor's office. You know, they are top priority as public safety, and hopefully as you go through the news cycles that you do your part to make sure we're getting information out there, encouraging people to do things when it comes to you know, whether it's self-quarantine, whether it's limiting the sales to 50 to an area. You guys can have a lot to say about that when you do that. I ask what you can do to help with those situations that you do that. There's lots of things we can find something wrong with something. There will be, because this is a moving, a virus that happens every day. So I just ask that you support the issues when we do things, and you can get that information to the public. I just ask that you understand that. Thank you very much for having us here.
Stay. I'm staying just in case.
Rex, do you want to stay for a second? If you guys have any more additional local questions, we're willing to entertain those for a couple more minutes. The governor just had to get going.
Charlie?
Good morning, Mayor Lucas. When it comes to St. Patrick's Day tomorrow, are you making any kind of mandate toward bars and restaurants to close or cap capacity at a certain level to reduce the spread of this virus?
So what we have so far, and what we'll be issuing today, is an amended order that looks to our large event ban, which was 1,000 before. We'll be dropping that to 50, right? And I think we've seen that already. Dr. Archer, myself, and a number of others will be working today to look at what capacity for any number of establishments, lounges, taverns, restaurants should be. What I'm saying is that 50 may not be the only metric by which we're actually evaluating limits. It might also be a percentage capacity. In other cities, for example, you've seen capacity requirements in restaurants and bars go down to 50%. You've seen recommendations of down to 1/4. We expect to be in a position to issue that today, so necessarily that would precede St. Patrick's Day. We would love to have all the information possible for you now, but we expect, at least by this afternoon, to be able to share that with you. What I would recommend, though, for anyone who is looking out to go and enjoy, first, perhaps reconsider that. Second, certainly make sure that wherever they're going, both the establishment itself, but also the customers, try to go someplace where they can maintain social distancing, try to make sure that we're not seeing a massive run on bars, taverns, other establishments.
Other jurisdictions have closed.
Dr. Archer will add for you.
So the message that I don't think is getting out strongly enough is that this disease is causing the most illness of hospitalization and potential death in folks that are over 60, in folks that have pre-existing conditions with heart, lung, or immune problems. And as you get older, over 70, and if you have those conditions also, the risk goes way up. So on top of these other concerns, people need to be taking that personal responsibility to protect themselves. And so I recommend anybody over 60 or with preconditions to not be out in these venues. And if you're over 70 and you have these conditions, I'm telling you as a medical doctor for Kansas City, Missouri, that you should avoid these situations. It's in your own best interest.
We'll go in order, so start there and go on down. Yes, ma'am. Yes, ma'am.
Question. As far as with the 50 people to events, why are we still sending thousands of kids to schools? Are schools going to be closed down, or where are we at with that?
So at this point, and I'll have Dr. Archer speak in a moment, we are not making a recommendation as to schools, and there are a number of different reasons in connection with that. As we noted before, right, situations may change, but our medical advice as to this point does not involve a massive closure of schools. Dr. Archer, if you'd like to add.
So the science is different with influenza than with this coronavirus. With influenza, the disease spreads through schools out into the population, and we have more illness problems with kids. We're seeing very few kids under 19 get this disease at all, and they apparently are not shedding the virus at a level that it's very contagious. Closing schools has all kinds of other negative implications. Teen pregnancy rates often go up. Violence can go up. Kids aren't then learning. We have like 90% of our kids in one school district in the city that are on free and reduced school lunch and are taking backpacks home over the weekend. Feeding kids is important. Folks that don't have access to child care, now are they going to take off work to watch their child at home, or are we going to end up shifting those kids into overcrowded child care settings? So we really need to get past what I would almost call a mass hysteria of some of these decisions and think through what are the positives and negatives of this. Now, each school district can independently make these decisions. We have asked the governor and DESE to be thinking about, let's not penalize schools for dropping in attendance. And the other part is, any parent who is concerned can keep their kids home. So you already voluntarily have a way to protect your kids if you're concerned about this without closing the school and creating hardships for everybody else. So that's my position right now. The CDC does not recommend school closure at all.
Let's keep going. Charlie, we got you. John, are you good? Allie?
I'm going to try and jam two questions into one, so bear with me. Mayor Lucas, on Saturday you were still advocating eating at local restaurants. Yesterday you were reacting to an Uber driver's dispatch from Westport that social distancing wasn't really happening. We've got schools recommended to be closed in Kansas, but not in Missouri. Some jurisdictions are shuttering bars and restaurants entirely. Are you at all confused that the patchwork of messages from local authorities and authorities across the country might be confusing people as to what they should be doing to react to this virus?
Short answer is yes, actually. I think the longer answer is that's why we have opportunities like this to try to visit with you. A few things that actually the governor noted that I think are important. One, we listen to science. We're listening to recommendations from our health directors and others. If Dr. Archer's advice today is that we do not need to close schools in Kansas City, then I'm going to listen to it and not substitute just either crowds, Twitter, anything else to give me some form of direction. If that changes, then I think our recommendation will change. Simple as that. I think the second point is this. We're trying to make sure, while we balance, that we continue to support the functioning of our society, our economy, et cetera. In our meeting earlier today, for example, we had the Director of Neighborhoods and Housing Services in the meeting with the governor and our health professionals, et cetera. There's a very simple reason for that. It is because we have incredible impacts to our homeless population. We have folks that are going out of work now. We've had a number of businesses in Kansas City close already in response to this crisis. We understand that there is an ongoing challenge in connection with it. So every step that we take is one that is going to be based upon medical professional advice, not substituting the whims of either crowds or our own viewpoints in those given situations. Shutting down large events last week wasn't just that we looked at what other people were doing, it actually was based on scientific advice. The fact that today in Kansas City folks can still go to a restaurant with 10 people in it is based upon our scientific advice and recommendations in connection with it. And frankly, we try to communicate as much as possible with the state, with other jurisdictions, both in western Missouri and Kansas, and our federal government to make sure that we can be as consistent as possible. But I will say this, somewhat unabashedly, Kansas City, Missouri will take the best advice that we can in making notifications as to what we need to do. We're the first community in this region to create a threshold at the number of 50. Today we will evaluate whether we'd like to look at capacity limits and reduction in capacity by a basis of percentage. We will take those steps even if other jurisdictions do not. The reason we will take those steps is because it's based on solid medical and scientific advice, and we'll continue to do that throughout this crisis. And to the extent that our advice may shift on Monday versus what you heard on Saturday or even last week. I understand there is some concern. A week ago, we were going to have a Big 12 tournament played in Kansas City. That ultimately did not happen. This is a fluid situation. We understand that, and that's why we will try to take as many opportunities, I know Dr. Archer does this as well, to speak to the public about where we are and what it's based on. But if there's someone out there who has a question about why we do what we do, the answer is a very simple one. It's to keep the community safe in as many situations as possible. And keeping the community safe means listening to solid, sound, scientific recommendations and instituting those. It does not simply mean throwing out any order that we've seen anywhere in the world or in our country and just saying everyone must live with it. I think that's largely what we just heard in the answer as it relates to schools. John.
Mr. Mayor, we have hundreds, if not thousands, of workers in this city in the hospitality industry who may face 8 weeks of lost income based on restrictions being imposed or individual decisions on businesses. What do you tell those folks, if anything, and would you be willing to lobby on their behalf to the federal government for direct aid to make up for lost income?
Well, that's one of the easiest questions I've had in a while. So absolutely, yes, I'd be willing to lobby to the federal government on direct aid to make up for lost income. I think we're going to have to take more concrete steps. I'll say this first. There are lots of people who have already been impacted by the spread of this pandemic, and lots of people have been impacted in Kansas City as a result of it. I've talked to workers who have lost jobs. I've talked to business owners who have elected to shutter their businesses. And I'll say this as something that's even more important. Some of them will be able to bounce back. For some of us, if we took 6 weeks off, even as mayor, right, we'd come back, we'd have our job, that sort of thing. There are other businesses that it will not be that easy. There are families that will have to make very difficult choices about what bills to pay, and that is something that weighs on all of us before these decisions are made. Frankly, I think this is why we listen to our advice fairly clearly and don't just respond to cries to say, do this or do that. And so what we will try to do on the local level are a few different things. One is to make sure that to the extent that we can reserve resources, i.e. money, to help support those who have fallen out of work, and I understand it won't just be now, but in the months ahead, probably over the budget year ahead, we will try to make sure we do that, making sure that we can try to stimulate economies, particularly the hospitality industry, restaurant, entertainment, to make sure that we can at least help them as they try to reestablish their businesses, as employees are trying to continue. My office has worked throughout the weekend and the last week or so to try to make sure we're addressing those. And that will be finding budget space, including in this next year's budget, which is to be voted on exceedingly soon, in connection with finding that level of funding support. That's one. Another thing that we will continue to do with our lobbying teams in Jefferson City is trying to make sure that we can actually avoid areas like preemption on getting a citywide policy on sick leave for folks. We think that's going to be vital. And frankly, we think it's a time that we get past kind of political divisions and how we're looking to support the welfare of people in our city. And so that's going to be another important step. And then finally, there is this. Ms. Kite noted it. I do think it's important for us to support local businesses. I think we see more advice from folks that suggest to the extent we do that, we do want to make sure we maintain social distancing. That's something that I've looked to maintain throughout this crisis, one that I've done over the past days. That's something I'll continue to do, but to the extent you're ordering out, to the extent that you're doing any other type of business, making sure that you're supporting local, the folks that need to survive. While it's interesting to all stand in the line for toilet paper at Costco, there are lots of local businesses in Kansas City that need your support as well, and so I would encourage anyone to make sure they're taking those steps. Yes.
So on this issue of sick leave that the mayor mentioned, a couple of years ago, myself and another staff member of the Health Department published an article in Health Security on the fact that we don't, as a nation, have sick leave where almost every other developed nation does. So if we can't use this crisis to fix that, to where we have a national requirement for sick leave and quarantine leave, right now, if you go to certain establishments that don't have sick leave, you don't know what you're being exposed to, because those workers have to make that choice of staying home or not getting paid. And that we shouldn't be doing in a country with our resources.
Mr. Mayor, I just want to make sure I heard you correctly that you will look for ways to provide local assistance
Yes.
to displaced workers and businesses?
Yes, I will note. So the short answer is yes. Longer answer for that is we will need to find ways to better deploy it. We will need to find ways to make sure we can find that funding, frankly, as soon as possible. And frankly, you have to find a way to actually be fair as you distribute it. There are other markets in the country that have been able to do so thus far. That's something we're looking to evaluate as well.
And how do you envision what form that might take?
Right now, there are a few different tools that local government often uses. One that I don't think is broad enough to help people that you often see relates to tax breaks or extension of certain tax due dates. That's an option. I think there are other options such as either the waiver in a fair way of fees, licensing fees, et cetera, that folks are being asked to pay. That's something that we can evaluate. We'll have to adhere as we do so to the Hancock Amendment in Missouri, et cetera. And so that's the sort of thing we're looking to evaluate yet. I will note we have not finalized what that looks like yet, but that's something that we're trying to explore. City communications.
Yes, I have a question from social media from the city of Kansas City, and they want to know why the airport is not making it mandatory for hand sanitizer.
I'm going to need you to speak up just a little.
I have a question, and they want to know why is the airport not making it mandatory for hand sanitizing before boarding planes? And are they still serving snacks without wearing gloves?
That's it.
Airport hand sanitizer requirements and certain snacks.
So I got airport.
And hand sanitizer requirements at the airport.
Why is there not a requirement for hand sanitizer at the airport? You know what? I will admit to not having full knowledge of that. I understand that the Aviation Department has shared with us that they have increased their cleaning, there's soap and water available, there is hand sanitizer available. I guess the question gets to the fact that why don't we make every person who gets off a plane immediately hand sanitize? I think frankly, the Aviation Department, much like our Health Department and many others, is looking to advice of our federal partners, but I will be sure to ask that question to our Director of Aviation, particularly seeing if the FAA itself has issued such a requirement for everyone who's getting off planes.
We can take 2 more questions.
Any other questions? Lisa?
Dr. Archer, how many
Actually, Michael, we'll make sure we get Lisa first. Lisa?
How do you enforce the prohibition of events of 50 or more people, and what's the consequence for breaking that prohibition?
So a few different areas. One, and we have departments that work with it, both the Health Department and regulated industries. There are a number of penalties that increase as they crescendo for ordinance violations. We would use the same types of penalties we use in regulated industries for those who are letting in minors without minors, I guess, generally, or those who exceed their occupancy limits already. And so that includes both financial penalties, eventually revocation of licensure, and frankly, other penalties and suspensions as time goes on. Coming up with penalties for those who don't follow city codes and ordinances is actually something we do have some level of experience with. We would look to be doing so and instituting that, frankly, immediately upon passage of any orders, et cetera. For those who actually do consistently create some sort of concern or not following, we do have the ability to bar the doors of certain events, certain venues, et cetera. So if somebody tomorrow says, to hell with all of them, I'm going to have the world's biggest St. Patrick's Day celebration come to my whatever establishment, we are able, if learning about that, to actually institute a closure order for that to shut it down using all of our different opportunities, both the fire marshal, health department, regulated industries, and the police department. Mr. Mahoney.
To regulate how many people are in their establishment, it's on, the proprietor of the bar or restaurant.
So we're able to send in regulators under the authority of the city, usually through regulated industries, to make sure that they are adhering to proper numbers. If we issue an order as to distancing, then we would be able to do that as well. That's just a function of having our workforce go out and do that. And I think our regulated industries department understands that at this time, a resource shift in connection with that is something that they'll be deputized to do. Michael.
Dr. Archer, just a scoreboard question. How many tests have been conducted in Kansas City, Missouri thus far? How many more tests do you have available to supply?
So there is not a restriction on the availability of tests. I want to make that clear. Right now, if they meet the requirements for CDC screening, we can get those submitted. We actually ran a sample up a couple nights ago where we drove it up to the state lab in the evening. The number that we're testing, I'd have to get back with my staff to see because we had some submitted over the weekend, so I don't have that most current number. The important number is that there have been 0 positives at this point. So I want to emphasize that there's 0 positives at this point. Do I believe that there are some folks, and I say some, not a lot, that probably have the virus out in the community right now? Yes. That's why hopefully on April 1, when we can open this up and do other types of screening, we'll be able to move that forward. We are encouraging folks to see their private doctors, calling first if they have cough and fever, so that they can get tested on the private side. But we have no reports yet on the private side of any positive tests for Kansas City, Missouri residents.
From here to April 1st, it's a long bridge. It's a long amount of time.
You know, when you heard the State Health Department Director talking about 170 tests that have been done, 6 positives of the highest risk population, so 3.5%. When we open this up, the chances of it going up in percentage is very unlikely. It's going to actually drop. We may actually have to test 1,000 people to get a positive sample. So we'll see how this outbreak evolves. Right now, the real message isn't whether we're testing or not. It's, are the high-risk folks avoiding population places that they can get this disease until we do have the testing capability to be managing this. The other thing, kind of following up on the other question, the manager of that facility is the one that's responsible for meeting all the different codes and regulations for that facility to stay open. So whether it's meeting fire code, the health codes in regards to preparation of food, all the different things are on that manager of that facility. And if they violate that, yes, we can pull and will pull their permits and licenses if they're not doing what they're supposed to be doing.
So we were going to go ahead and have that conclude our questions. I wanted to let you know a few things that we're doing today to continue our work with this. Later this afternoon, myself, Dr. Archer, and city leadership will be meeting with our hospital executives throughout the community to make sure that we're up to date on our response, including looking at resources ranging from ventilators and ICUs to our ability to handle more patients over the weeks and months ahead. I have been in communication with some of our hospital directors who have noted some of the economic impact on them as well. You're seeing a decline in elective surgeries and other procedures at hospitals. What that means is that, of course, revenues that usually come in on the positive side to them are diminishing. That's going to be another economic factor in connection with this over the months ahead. Frankly, some hospitals, particularly your safety net hospitals, having fewer resources to try to address the magnitude of our challenge for us. We're also organizing a call with public school superintendents in Kansas City, Missouri. We have 14 and other school leadership to make sure, to the point that was made before, that we do have some consistency, at least in the direction that we're able to provide day by day. As I noted earlier, we'll have further recommendations as to social distancing requirements in business establishments, restaurants, taverns, etc. And so we will have that to share with you as time goes on. And then the City Council itself of Kansas City will be meeting later today for an update generally with this. We expect more direction on public meetings, public events, boards and commissions, etc. We want to make sure that every part of Kansas City government is being consistent. I'll make this one other point because we did receive a question relating to the economic impact upon a number of communities, particularly communities that struggle. We recognize that this will ultimately and can ultimately have an impact on our homeless population, those in public housing, those who rely on public resources. The public library itself is closing for a measure of time. Those decisions aren't taken lightly. We understand that for a number of people, that's where one gets food, that's where one spends a good portion of their days, and we also need to make sure that as we have lots of folks in our shelters, that we're looking at bed space in our community centers as well. And so, frankly, this is something that we're looking to work through. This is a fluid situation. We understand that money, that resources are going to be a part of it. Throughout all of this, we're using science, our medical professionals, to help give us recommendations of how we can best treat this challenge in our community. So with that, we'll give you further updates as they're warranted, and I thank you for your time.